During this video, we'll explain what's involved in an endovascular repair of an abdominal aortic aneurysm. This is a minimally invasive procedure done from within the blood vessels. You'll lie flat on your back on a special table equipped with a fluoroscope, a rotating X-ray imaging device. A small incision or cut is made over one of your arteries, usually near your groin. A thin, flexible tube known as a catheter is inserted into the artery. The catheter is carefully guided to the area that's being examined. The dye is injected and shows the inside of the blood vessels while a series of X-rays are taken. The fluoroscope will move around your body to record pictures from multiple angles. The surgeon will identify and examine the aneurysm. An artificial graft will be sized up for your personal requirements. The size and shape may vary from the one shown here, depending on if the blood vessels to the legs, kidneys, or intestines are affected by the aneurysm. The correct sized and shaped graft will be mounted onto the catheter. This will be carefully guided into position from within the aorta. It will be opened and locked into position to form a watertight seal. The graft will reinforce the walls of the aorta and any nearby branches. Additional graft components may be used to extend the graft into the blood vessels supplying your legs, kidneys, or intestines. Blood will now travel through the graft, and there will be no pressure on the weakened aneurysm wall. Further X-rays are taken to confirm the positioning of the graft and adequate blood flow to your legs and organs. When satisfied, the catheter will be removed. The incisions in your groin will be closed with sutures or skin staples. Pressure will be applied to the groin to reduce the risk of bleeding. Sometimes this may be done by hand or with a pressure cuff device. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.